I'm Jonathan Jabbett, the CEO and founder of NeuroRX. And NeuroRX is working to bring forward Cyclorad, the first drug targeted at treating acute suicidal ideation and behavior in patients with bipolar depression. The only thing we know for certain is that between now and this time tomorrow, 1,000 people with bipolar depression are going to die needlessly of suicide. We understand the chemical target, and we've recognized that suicide is not just a tragedy, suicide is a druggable target. So, over the last 30 years, scientists, including my brother Dan Jabbett, have recognized that the NMDA receptor in the brain drives the rate at which people formulate new ideas. It's the seat of creativity, but it's also the regulator, the speed regulator of that creativity. And unfortunately, at high levels of NMDA activity, the rate of new ideas is slowed to a crawl. Those ideas tend to be negative in nature, and frequently, all too frequently, that triggers a suicidal depression. We know that if we can appropriately target the NMDA receptor, we can increase the rate at which thoughts are formulated, in other words, increase the rate of ideation and decrease depression. The challenge is all NMDA drugs until now have had the side effect, not even a side effect, but a main drug effect of inducing hallucinations and psychosis in the process. Our innovation is that we've discovered that if you simultaneously target the NMDA receptor and the 5-HT2A receptor in the brain, you can decrease depression by at least 50%, decrease suicidal ideation by 75%, without causing untoward side effects. So that's the drug that we're bringing forward into the clinic. We have 2 human phase 2A studies that show the ability to produce those effects in human beings who have acute depression. The FDA has just cleared our IND, our investigational new drug license, to do a pivotal study in 150 patients. And if that study is successful, we're talking about launching a drug by 2019 that has the ability, the first ability, to decrease depression and suicidality in a population of patients for whom the only alternative today is electroshock therapy. Patients for whom there is no drug, patients who have a higher risk of mortality than patients with any known cancer. So that's our mission. We're grateful to WuXi for supporting us in that mission, and we look forward to bringing you good news next year.